Hi everyone, welcome to my Friday night's live session. Today we have quite breaking news actually. We have Dr. Uma, who is an obstetric and gynecologist, who will be joining us to talk about COVID-19, its vaccines, and pregnancy.
Right.
That's
So
right.
what about pregnant women and COVID-19 vaccine? So should pregnant women get COVID-19 vaccine now that we know that they're considered high risk?
Yes, yes, and yes. As I mentioned, they tend to get the severe form of the illness. So obviously they're high risk, and we would advocate vaccination for pregnant mothers. The thing is, we've got 3 vaccines at the moment in the country. So we've got the mRNA vaccine, which is the Pfizer. And then we've got the viral vector vaccine, which is the AstraZeneca. And we've got the inactivated vaccine, the Sinovac. But all 3 vaccines are not contraindicated in pregnancy and breastfeeding. We know that.
Yes.
But the largest data set that we have with regards to pregnant women is the mRNA vaccine, which is why initially we decided and we recommended to only give Pfizer to pregnant women. As of today, hot news from today, basically, I think the ministry has decided to give all 3 vaccines to pregnant women because there is no real adverse effects from giving these vaccines. There's no reported bad outcomes so far. Basically, we give these vaccine, it's recommended to be given from 14 weeks of gestation to 33 weeks of gestation. So why 14 weeks? Basically, the first trimester is where the embryogenesis happens, which means the fetus is being formed, the embryo is being formed, the vital organs are formed. So it's crucial at this point not to intervene with any form of, external factors that we don't know much about. So usually any form of intervention in the first trimester, we are usually quite apprehensive being OBGYN. So we start from early second trimester, 14 weeks to 33 weeks. So this is basically with regards to the first dose. So if you've received your first dose at 33 weeks, for instance, you still got like another 3 weeks for your second dose, and you still be able to get it before you go into labor. So that's the whole idea of giving it from 14 to 33 weeks.
Okay, so what if they do go into labor prematurely? So if they get it at 33 weeks, and just say for whatever reason they go into labor at 37 weeks instead of the usual 38 onwards, do you give the vaccine after that? Do you still give a second dose after delivery?
Yeah, so we do give the second dose after delivery. So it's usually 6 weeks postpartum. So it's in the puerperium. So after the puerperium, 6 weeks postpartum, they can get the second dose.
So does the vaccine given in the second and a little bit of third trimester cause any issues with the fetus, or does it cause premature delivery?
The recent evidence and whatever studies that has been done, right, there is no association with increased miscarriages, even second trimester miscarriages, preterm birth, stillbirth, and neonatal death. So there has been no causal relationship between the vaccine and these outcomes. So studies are still ongoing. We know that the evidence is evolving, but at the moment, there is no substantial evidence to prove that. So it's actually quite safe.